Good morning, Peter Goertz. I'm a psychiatrist. What is reality? Is this guy talking about something esoteric? Is it a stupid question? In my opinion, there are interesting aspects to consider with this issue, and especially as a psychiatrist. As a psychiatrist, you hear a lot of bizarre things, at least they seem on the surface to sound bizarre. Delusional things, possibly delusional things. It can be tricky to tease that out. For example, just a quick example, a patient of mine on an inpatient psychiatric ward had complained about her neighbor knocking on her door at all hours of the day and night, and even said the neighbor put a video camera into her apartment. And I thought she was entirely delusional regarding these things. However, it turned out the neighbor actually admitted that he'd been knocking on her door at all hours of the day and night, but he did not put a video camera into her apartment. So things can be tricky. There can be a combination of delusional thinking and actual occurrences that happened. And it can be the other way around also, in that I remember a patient was talking about his wife cheating on him, and I thought, well, I didn't doubt it initially when he talked about it, and then I read his chart, and it turned out this had been an ongoing delusion. So we really can err in our assessment of patients and people in general. And what seems to be important to me to realize is it seems that each person at a given time has their own reality. And in that sense, even delusions are real, because for that person at that given time, that thinking is their reality. And that, to me, seems to have practical implications for psychiatry and also, of course, in general. So as psychiatrists, again, we see patients with various potentially unusual realities. Psychosis, someone might be delusional from mania, depression, schizophrenia, for example. Someone may be dissociating on a regular basis. In an extreme, they may have dissociative identity disorder, formerly known as multiple personality disorder. So recurrent changes in their reality, and maybe even associated with those recurrent changes in reality, even physiological changes. So, for example, switching from one personality into another, they might have actual physiological recurrent changes. I remember once I was stuck in an elevator with 10 other people. It was only intended for 6 people, that elevator. And each person reacted differently. We were stuck for about 45 minutes in that elevator. Each person, there were different people with different reactions. Some people got very angry, started kicking the door. Some people laughed. Some people got very anxious. So each person in the same external situation had very different responses to the same external reality, meaning that they had different internal realities. So that's what I was talking about with, it seems that each person has their own subjective reality, which is crucial for that person because that is their reality, even if they're delusional. And if we're dreaming and wake up, it seems that we transition from one reality to another, from the dreaming reality to wakefulness, and vice versa. You know, if you're awake and falling asleep, you're transitioning from one reality to another. If we're taking medications, especially certain medications like steroids, they might alter our perception of reality and our reality, our internal subjective reality. Antidepressants might change that reality in the long term, mood stabilizers and other prescription drugs. Street drugs, of course, can change our reality, like LSD. Alcohol can change our reality. And we want to be careful also because that can have safety implications. I remember when I was a resident, one of the child psychiatry doctors mentioned an example. I think it was an adolescent walking in the hallway, and another adolescent was just walking along in the same hallway. And the first adolescent just turned around and out of the blue punched that adolescent in the face, as far as I recall. And it turns out, I'm not sure exactly what the situation was, but he had the belief that he needed to defend himself at that moment. So these beliefs that we have, our internal realities, definitely have practical implications. And one thing to consider is that we as humans seem to have limited abilities in our perception, our thinking, our understanding, and we may not really be able to begin to understand this world, which is a humbling notion. Thank you.